I have some exciting news. I am getting a breast augmentation. I'm about 4 or 5 days out from getting my surgery and I'm so excited. So I'm going to take you along my journey. Ever since I was younger, there's just always been a whole list of like surgeries and cosmetic stuff that I want to get done. And it's like the first big thing that I'm crossing off my list. Like I've done obviously small stuff before, but this is like the first actual surgery that I'm having. So I'm excited and I'm nervous, but I chose a really good plastic surgeon in Toronto. His name is Dr. Jugenburg, Dr. Six, if you will. So I'm gonna vlog my journey. So right now my surgery is on Tuesday and it is Friday. So I actually work 3 night shifts before my surgeries, and I'm gonna be going into my surgery coming off a night shift, which probably isn't ideal because my body's gonna be maybe not in the best state, but like it is what it is. I think I'm pretty healthy to start with, so fingers crossed, no complications. I'm like mostly nervous for the anesthetic for some reason. I'm like, what if I don't wake up? Like what if I have brain damage? I'm not worried about the surgery. I think the healing will be fine. It's just like the anesthetic I'm a little worried about, but then I think about all of my patients who are like older, who've had surgery and like they have a lot of health issues and they're fine. So I think I should be okay too. It's just my anxiety. So this is me a couple days out. I do have some footage of me going to the pre-op appointments and stuff, which I won't get into it, but basically I'm gonna go with moderate profile and just like normal, and I'm getting saline because I don't want them to rupture, and I personally think that saline is the better option. It's the healthier, safer option, whatever. So I'm gonna go with saline, and I don't want them super up here in my face. I don't want people to be like, oh, she definitely has her boobs done. I just want them to be more proportionate to my body. I'm at a lower body fat percentage than I have been recently, and I just think like I would like something up here. Like when I gain and lose weight, it definitely, a lot of it comes from my upper chest area. So as you can see, this is my before. It's like pretty flat. Like I do have some stuff here, but it's not really anything, and I kind of want it to be a little more like girly looking. I want my rib cage to look a little bit smaller because I want this to stick out more. This is it from the side. Yeah, there's not a lot there. I know when I weighed about 40 pounds more, I had like double D, but obviously I don't want to be 40 pounds more, and I don't think that was a healthy weight for me, and I hope I never go back to being 40 pounds more because then I'm gonna have huge boobs with my fake boobs. But I just want like nice little pizzazz up here. Volume, but not too much. So basically they told us 2 weeks before the surgery, you cannot drink, you can't smoke any weed or anything, you can't take any supplements, you can't really eat garlic or onions or anything with vitamin K, because I know that affects like your clotting abilities or can increase your risk of bleeding. I've been trying to avoid those foods. I haven't been drinking, I haven't been smoking. I don't smoke anyway, so that was easy. So I'm just trying to do all the right things, trying to stay healthy. I actually ended up getting COVID like 2 weeks ago, really bad timing, and I was like, what if it leads to like a blood clot or something? But I think I'll be okay. They did actually give me a discount code for some post-op garments and stuff, but it was like $200, and I was like, that's not gonna happen. So I bought these on AliExpress. I know I'm like trying to get away from fast fashion, but I just wanted something that wasn't too expensive that I could get. So yeah, just basically bras that undo at the front, so that when you're healing from your surgery, you don't want to be lifting your head or having to reach around to undo your bra. These are really nice. I just got like black and white. I think that they'll fit me, hopefully. I don't know how big they're gonna be, but yeah, I think that these will be cute to wear underneath. And they told me that you're supposed to take a week off work, which if you have an office job, it can be a week off work, but if you have a labor intensive job like I do, because I'm a nurse, they said like 2 weeks, but I'm actually not taking any time off work. So we'll see how that goes. I have a lot of stuff planned for this month, like December. I'm going to New York, I'm going to an engagement party, it's gonna be Christmas, so there's a lot happening. I want to be able to work so I can get my paychecks. Yeah, I just hope that I'll be able to. I think the first couple days after surgery I'm going to take it easy, but I hope I'll be able to be back at work. I'll be on modified duty, but that's okay. Fingers crossed. I'll record everything going into my surgery and coming out of the surgery, so let's hope it goes well.
Did I ruin your video? Something called
Okay, so we are about 2 hours post-op. It went very smoothly. The pain right now is like a 3.5 out of 10. This is what they look like, obviously sitting very high. Honestly, I feel like the worst part was the anesthetic. I was just really nervous about it, but they were super nice and knowledgeable. And my fiance picked me up, and now we're just eating food. I'm not nauseous, just like obviously some tightness and pain. I'm happy, and I look like death. So I'm officially less than 24 hours post-op. This is like my second day waking up. I'm just gonna give a little update for day 1, I guess. The pain is a little bit more today. I would say like 5 out of 10. It's kind of hard to take a deep breath. It hurts to like get up straight. It hurts to move your arms. Like, what did I expect after a surgery like this? The surgery itself went really well. It was like, I think 45 minutes tops. And then I was in the recovery room. I think the worst part for me was just the anesthetic. I was so nervous for it. I wasn't really nervous for the surgery, just like, what if something goes wrong during the anesthetic and like I literally die during an elective procedure? Like, how horrible would that be? Obviously everything went fine. I talked to, sorry, it's like kind of hard to breathe because I can't breathe in fully with the pain, but I talked to the anesthesiologist when I was on the operating table. I just said like, I'm really nervous about it. I asked if I would be intubated, and he said it's like a mini intubation device. Like, it doesn't fully go right into my lungs, which I was worried about. It goes about halfway. And I know sometimes people complain about like pain the next day. So yeah, I did have a little bit of pain after the surgery. I don't know if I was like cleansing my jaw, but my jaw just felt really tight and my throat was like a little sore, but like whatever. Literally no big deal. He did post the surgery on Snapchat, which is so cool. Getting to see my own surgery, like was amazing. So obviously I screen recorded that so I can look back on it. For my surgery, they did give me a prescription to the pharmacy for like a bunch of medications. And to be honest, like I don't want to take all the medications unless I really have to, just because some of them are like perks and Tylenol 3s, and like if I can manage it with Tylenol regular strength, then I think I'm gonna try to. But last night I had to take a perk just to get like a nice comfortable sleep because I'm stupid and I worked a night shift the night before my surgery. So I was coming off a night shift for my 3rd night shift in a row, and I was also accidentally in withdrawal from my antidepressants because I tried to get a prescription filled last week, but I had some issues getting it filled, and they finally filled it like Monday night. But at that point I was already NPO, so I couldn't take it. So I've basically kind of been in withdrawal from the antidepressants since last week. If anybody takes antidepressants, they'll know that the withdrawal from them is just not pleasant at all, especially when you cut cold turkey. Like, you get brain zaps, you get flu-like symptoms, you feel so terrible, you get a lot of GI upset, you're extremely moody, it's like you're PMSing basically all the time. Yeah, they gave me a prescription, perks, T3s, an antibiotic that I started before the surgery, and now it's just every 6 hours. They did give lorazepam, I think it's 1 milligram sublingual. They gave 3 of them. So I've taken 1 last night just to help me sleep a little bit because my circadian rhythm is like all messed up from working and from my freaking antidepressants as well. So I might take another perk this morning just to help with a little bit of a pain because I do want to like get some stuff done today. Other than that, like I didn't have any issues with post-op the surgery. Like I wasn't nauseous. I came to it pretty quickly as well. I was like talking to the nurse in the recovery room, and of course I had to mention I'm a nurse too because yeah. So we just talked about like our experiences and stuff. So I felt like pretty with it. But the only thing is like my legs were shaking like crazy after the anesthetic. Like when I was waking up, they were literally going like this. And I could like hear them going against the stretcher, like moving it. I was like, is this normal? They're like, yeah, it's fine. Like it's just the anesthetic wearing off. But thank God, because like that was like the most uncomfortable part. And then when I was going under for the anesthetic, he put in the IV first and he just kind of explained what will happen. Like, I'll ask you to move your toes around, we'll put the oxygen, and then you'll start feeling like you have to cough or like your body feels heavy, and that's exactly what happened. Like I could feel it go over me, and I just remember saying to them like, oh, I don't like this feeling, I don't like it, because it just felt like I was like being sunken into a hole, kind of. Anyway, I'm fine from it. I survived, and I saw the videos on Snapchat, and like when they were inflating them, because I got saline, they were so horrible looking at first. Like I knew they were going to be. It's just because they're just inflated. My skin is so tight, and they looked like big balloons on my chest, which I'm not going for that look of breast implants. I really wanted a natural look, but I know that they will settle, and he even said it in the video. But yeah, so this is so far what they're sitting obviously very high, extremely fake looking. Anyway, so yeah, other than that, it's been so far so good. I'm hoping the pain peaks today and tomorrow and just goes downhill from there, because I do have a lot of stuff planned for December that I'm gonna have to do, and yeah, I want to be able to enjoy them. And I'm also planning on going back to work for my next rotation, which is like on Monday, so hopefully that. I just changed my bra. We are how many hours post-op? 48 hours almost post-op, and yeah, the pain is still pretty intense, but I'm happy with them so far. I definitely hope that they settle like a teeny tiny bit, because this is looking very intense, but they will. Good morning. It is now day like 2.5, 3 post-op, and I'm not gonna lie, this is definitely the most painful day so far. I woke up 6 a.m., took my antibiotics, and then I was like, I need some pain medication because it hurts, and like you can't move yourself up in bed because you're like everything is so tight and sore. I'm hoping this is like the peak of the pain and then it just gets better from here because this is pretty painful. So yeah, very painful, very tight feeling. So I didn't want to take the oxys, but I think I need to. It is day 4 and I look like poop. I went out yesterday to my friend's engagement party and I didn't drink anything, but yeah, doing okay. Still sitting very high. Oh my goodness, they look huge. Pain 2, 3 out of 10, I would say. Okay, so this is my 1 week mark and I'm going to take the tapes off. So basically these have been on for a week since the surgery, and this appointment is basically to take the tapes off and it's just like a follow-up. So yeah, I think that they're dropping nicely, definitely sitting less high than they originally were. Pain still minimal, like 1 out of 10. I can feel that something's there, but it doesn't necessarily hurt that much. Still looks a little bit weird from the side. Okay, so we are officially now 3 weeks out from the surgery. I just had my second follow-up appointment, took the stitches out. I'm very happy with the results. They're still gonna settle a little bit from here. I have to like massage them down like that. And apparently I don't massage them hard enough, so I need to, I think, go a little harder. But she said I can stop massaging once they're sitting where I want them to be. So yeah, this is them right now. Definitely a big change from before. Very happy. It was way easier than I thought it would be, the whole experience, and feel a lot better about myself now and like how I look. Yeah, it was worth it and I'm happy. So far so good. Maybe I'll make another video in like a year of like an update, but as of right now I just like my self-confidence is a lot higher. I just feel like I like what I see when I look in the mirror, which is like really nice for a change. Yeah, it's like nice to feel good about yourself. So far I'm loving them. If you're on the fence about doing them, I would say do your research, talk to a few surgeons, get their input, and go for it. If you having any hesitations, like whatever, if it makes you feel good about yourself, do it. This is my video. I hope you enjoyed it. If you have gotten a breast augmentation or are thinking about it or have any questions, like you can leave a comment below and I will definitely get back to you. Thanks for watching.